This is a Fox News alert. There is a bombshell new report out on the consequences of the healthcare overhaul. A brand new study finding that 74% of the doctors surveyed, and there were at least 2,400 of them, 2,700 I think, 2,400, at least 2,400% or 74% of them plan on either retiring, going to work just part-time, or quitting medicine altogether after the healthcare law takes effect. Dr. Mark Siegel is part of our Fox News Medical A team, and he's my guest now. Doc, the survey says that there are two things. It's the market and the so-called post-reform era, the healthcare law they cite in particular. You've been predicting that there would be a mass exodus of physicians in the wake of this. Why? Why would they leave the practice altogether?
By the way, Megan, when the president said you get to keep your doctor, I said, hey, that's me. No one asked me. No one asked doctors whether they're going to be able to see these patients. First of all, over 60% said they're already full. They don't have room for more patients. Almost 70% said they don't like the health reform bill. 87% said they can't see any more Medicare patients, and over 90% said they're not going to see more Medicaid patients. Over 60% said they don't have enough time to spend with their patients. That's the key problem. We don't have enough time. So if our waiting rooms are already full and you give us more and more patients, we're either going to flee or we're going to see less patients or spend less time.
How is it going to work as a practical matter? I mean, can the government force you to see more patients? I mean, in the wake of this healthcare law, can they call up Dr. Siegel and say, we've got another 30 million people who are insured now. You have to see them. You have to take their insurance and you have to see them. They're insured by this government-sponsored exchange. See them.
That's not what's going to happen. This physician survey shows that over 60% are going to restrict their practices, go part-time, join hospitals or large groups who they can afford to pay. Because hospitals aren't going to close.
Right.
Universities aren't going to close. They're going to say, let's hire doctors for cheap that can no longer afford to stay in private practice.
But it's hard to believe that a doctor who goes to college for 4 years, medical school for 4 years, a residency probably for another 3, maybe a fellowship of 1 or 2 years on top of that, you know, all those years of training is just going to say, forget it. I'm going to go apply at, you know, Barnes & Noble because of the new health care law. It doesn't seem plausible.
It's not going to happen that way. You're absolutely right. What they're going to do, though, is they're not going to be able to keep their shingle up where they're a solo practitioner.
They can't all go to hospitals. There aren't enough hospitals hiring.
They're going to go to clinics. They're going to go to drug companies. They're going to work part-time and figure out a non-medical way to supplement their income. Or they're going to go on salaries. It's not that they're all going to join hospitals, but keep in mind the bill is also providing something called an accountable care organization, which is going to reward quality of care, which is going to be based on cherry-picking patients that aren't that sick and not giving them the same kind of expensive services that they're used to. A solo practitioner like me is not going to be able to do that successfully. Look at the bottom line here. Look at the bottom line here. 18% increase in expenses. According to Medicare, 5% increase in fees.
It doesn't make mathematical sense.
Can't keep your office open.
So how does this work for the people out there watching this as a practical matter? Because obviously those who are not insured now, who are about to get insured, I'm sure they're happy to have whatever limited options that they can have because they're getting something that they didn't have otherwise. Maybe I'm wrong, but I'm guessing. But there are other people who are paying for their own health insurance now who do want to keep their relationship with their current doctor, men and women like you. And what's going to happen? Are they actually going to see their doctor leave and then be left with no one?
I think, and I've said this before on your program, they have to ask. Ask your doctor. Ask Dr. Mark Siegel. Ask whoever your doctor is. Are you going to stay in practice? Are you joining a group? You may be able to keep your doctor if that doctor joins the group. But you have to have that conversation. You have to say, where is your doctor going? Maybe a nurse practitioner is going to be hired. I don't want to scare people out there, but the medical terrain is changing. There's nothing wrong with nurse practitioners. We're going to see a lot more of them. The medical terrain is changing. This is not what the president said.
Let me ask you quickly, because I got to go, but how legitimate is this study?
Very legitimate. This is in my own experience. This study is clearly true in Texas, and I believe it's true around the country. I don't think 75% are going to quit, but I believe it's true that there's going to be a vast change in the medical terrain, and it will encompass probably 70% of physicians.
Yeah, they say quit or go part-time or go as
join large groups,
exactly.
Go to hospitals.
Dr. Mark Siegel, thank you.
Thanks, Megan.
Well, the Mexican